Very good evening, friends. Myself, Dr. Rakesh Sharma. Now you are watching Surgical Educator RKT. Today we are discussing about spleen. What is spleen? Importance of the spleen, causes of enlargement of the spleen, causes of rupture of spleen, how to manage rupture of the spleen, because spleen is the most common solid organ damaged or injured during blunt trauma abdomen, and sometimes it is a life-threatening emergency to save the patient. Spleen is a lymphoid organ. It plays a very important role in the immune system. At a point of the time, 65% of T cells and 15% of B cells in the spleen. So spleen plays a very important role in immunity. But sometimes some indication when splenectomy is required. So today we are discussing about function of the spleen, causes of enlargement of the spleen, what is the effect of the enlargement of the spleen on the body, and after trauma, what are the indications for splenectomy, and what is the step should be taken by a surgeon for during splenectomy. Spleen located under the left dome of the diaphragm, close to stomach, and behind the 9th, 10th and 11th ribs. It is already said that spleen is the largest lymphoid organ in the body. It is also called graveyard of the RBC because in hypersplenism condition, destruction of the cells, blood cells, RBC, WBC and platelets take place in the spleen. What is the function of the spleen? First is the lymphoid organ providing immunity, and in some animals it acts as a reservoir of blood, but not in human being. Now there are many causes of enlargement of spleen. Spleen enlargement is called splenomegaly. Of splenomegaly. Causes of splenomegaly. In our country is a tropical country. Tropical cause of enlargement of spleen like malaria, kala jar, schistosomiasis and typhoid. Some glycogen storage disease like Gaucher disease, von Gerke disease, Pompe disease is the collagen storage disease of spleen causing splenomegaly, and certain hematological malignancy like chronic myeloid leukemia, Hodgkin's lymphoma, infectious mononucleosis. In these conditions, spleen is enlarged, and certain hematological conditions like hereditary spherocytosis and ITP. ITP and hereditary spherocytosis are the most common reason for elective splenectomy. Now we are discussing about the splenic trauma. Spleen is the most common solid organ in the body to be injured in blunt trauma abdomen. It is point to be remembered, enlarged spleen is more liable to traumatic rupture because enlargement increases the friability of the spleen. 80% cause of splenectomy is post-traumatic rupture or post-traumatic injury of the spleen, and 20% are the elective splenectomy. Now we are discussing about trauma of the spleen. If any blunt injury occur in the left upper abdomen, or we suspecting the fracture 9, 10th and 11th ribs, splenic injury considered until proven otherwise. What are the clinical features of splenic trauma? First one, pain and tenderness over left hypochondrium. One important sign known as Kehr's signs. If blood collected under surface of left hemidiaphragm, so causing irritating of phrenic nerve, and pain radiating toward the tip of left scapula and shoulder. Difficulty in breathing, because splenic trauma not is a single entity. Mostly splenic trauma may be associated with fracture ribs and sometimes hemothorax. So what are the clinical signs of the patient we are suspecting splenic injury in common emergency? First, pallor, hypotension, tachycardia and air hunger. If 4 components are present, we are suspecting there is some chances of splenic injury. Splenectomy is the treatment of choice in case of splenic injury, but not in all cases. Splenectomy indicated when? What is the grade and extent of the injury? Second, most important, what is the hemodynamic stability of the patient? If injury is significant but patient is hemodynamic stable, we go for conservative treatment. If patient is hemodynamic unstable, so first thing, just exploratory laparotomy, see the condition of the patient. If spleen injured, there is massive hemoperitoneum, then urgent splenectomy required for the saving the life of the patient. So splenectomy in case of trauma is a life-saving operation. What is the grade of spleen? Grade of injury. Because we are discussing grade of injury. There are 4 grades of splenic injury, depend upon laceration of the spleen and the surface area of the subcapsular hematoma. First, grade 1, laceration of the spleen less than 1 centimeter. 1 or 1 centimeter is considered a grade 1. Grade 2, laceration of the spleen from 1 centimeter to 3 centimeter and subcapsular hematoma 10% of the total surface area of the spleen. Grade 3. Grade 3 splenic trauma, when the splenic laceration more than 3 centimeter and surface area 10 to 50% of the total surface area of the spleen. Grade 4. Grade 4 is some serious condition where laceration of spleen more than 3 centimeter, subcapsular hematoma more than 50% of the total surface of the area of the spleen, and most important, more than 25% of the devascularization of spleen, suspected hilar vessels injury. Okay. And grade 5, when the hilar injury, total avulsion of splenic artery or vein, and spleen sometimes fragmented in the pieces. It is called shattered spleen. It is the life-threatening emergency if surgery is not taken place in time. So we can't survive. We can't save the patient. So emergency splenectomy is a very important operation for the saving life of the patient in case of blunt trauma abdomen. Now we are discussing briefly about the procedure of the splenectomy. Type of surgery, either open splenectomy or laparoscopic splenectomy. In case of trauma, there is a large amount of the hemiperitoneum and patient is hemodynamic unstable, so we prefer open splenectomy. But in case of splenectomy, in condition like hereditary spherocytosis, ITP, and other elective procedure, but always remember, laparoscopy splenectomy easily done in mild to moderate enlargement of the spleen, not the massive enlargement of the spleen unless surgeons are well experienced in this surgery. What are the steps of splenectomy? First, patient in supine position, give left subcostal incision or midline incision from Jiffy-Sternum to up to umbilicus. Sometimes we have to enlarge our incision for the proper exposure. After opening abdomen, surgeon should place in the hand in between diaphragm and the lateral surface of the spleen and break the avascular adhesion of spleen. Then we push spleen medially towards the wound. Second, we open the posterior layer of linear ligament. So let's just say open and spleen came into the wound. And second, other attachment, important attachment, it is called gastrosplenic ligament, which contains short gastric arteries and epiploic vessels. Always remember, clamp should be towards the spleen, not towards the stomach, not very close to stomach. Otherwise, after ligating the vessels, chances of gastric fistula occur. After dividing gastrosplenic ligament and linear ligament, spleen in the wound. Now we have to take care of splenic vessels. Splenic vessels run over the superior wall of the pancreas. Very important thing. Splenic vein is tortuous, dilated, and very easy to rupture. So we have to create a window between splenic artery and vein and ligating. First we ligate artery so that blood supply of the spleen is cut off and spleen is decongested. So size of the spleen is reduced remarkably. So surgery is more easy. Then when ligated and cut it between the ligature and take off the spleen. Most important thing, because the tail of the pancreas is very close to hilum of the spleen. So we have to carefully dissected tail of pancreas from the hilum of the spleen. Otherwise, in case of iatrogenic injury of the tail of pancreas occur, that causing very troublesome and difficult to manage condition known as pancreatic fistula. If surgeon have any doubt, don't hesitate to put a drain in splenic region. What are the complications? First is hemorrhage. If slippage of the ligature occur, massive and catastrophic bleeding occur, infection. Because spleen play very important role in controlling infection, mostly encapsulated bacteria like pneumococcus, meningococcus, Neisseria, etc. We have to give vaccination. In case of elective surgery, vaccination against pneumococcus bacteria before 2 weeks. Or in case of emergency splenectomy, vaccination should be given just after surgery and second dose after 15 days. Other complication of splenectomy is the formation of the pancreatic fistula. If pancreatic fistula occur, then we have to put a drain. For closure of any fistula, 3 points should be noted. There is no obstruction, there is no infection and nutrition. For closure of any fistula, 3 points are required. That's all about splenectomy. Take care. I will upload next video very soon. I think it helped to understand the splenectomy and other things. Thank you.